I'll start off with a report about number of patients we're caring in Hartford Healthcare. We have 426 patients across acute across the system. Hospital Center Connecticut has 42 patients and 14 PUI. Midstate Medical Center has 32 patients who are positive and 14 PUI. We have 213 patients in Hartford Hospital and 27 PUI. Wyndham has 3 patients who are positive with 5 PUI. Bacchus has 9 patients who are positive and 5 PUI. Charlotte Hungerford has 19 patients who are positive and 8 PUI. St. Vincent has 108 patients and 14 PUI. We've seen total number of positive patient increase, about 10 across the system, but there were several patients actually who left our facilities as well. So we continue to see a small rise at the moment. It's about 4 to 5% of day over day increase in total number of patients we're caring for. This is consistent with our thinking that we're going to continue to see some increase, modest increase, till hopefully end of this week and maybe early next week. And then after that, we hope to see some flat plateauing across Connecticut. As I had mentioned earlier on, our concern still remains in the assisted living, SNF, and post-acute care area across the state as numbers have been obviously rising in those areas. We have 3 patients in behavioral health network and 88 patients we are caring with positive in community network, which are home care based, not in our acute facilities managed by the Hartford Healthcare, but the home care patients. Some of those patients actually been transitioned out of the acute hospitals, so there could be those patients left 1 hour of some other acute facility and then they're managed by our system. With that, I think I'm going to introduce Dr. Craig Allen today to go over some of the details about substance abuse and addiction during the epidemic time. Dr. Craig Allen is an expert in addiction services and addiction medicine. He's a medical director at Rushford. My pleasure to introduce Dr. Craig Allen. Craig.
Thank you, Dr. Kumar. These are difficult times for all of us. The stress and the anxiety, and for some, the isolation, are things that in the best of times wreak havoc for people who have substance use disorders or are in recovery from substance use disorders, and for people that have other mental health disorders. So I'm particularly concerned for what is going on in the homes or in the quarantine spaces for people that have been struggling in these areas. What we've seen is a significant decrease in the number of people who are coming in and asking and calling for help. I think part of that is a fear of getting sick or contracting the virus. But I'm concerned that part of that may be that people think we're not open or we're not available to help them. And we are. We're able to provide virtual assessments, so using telehealth, and even in some cases just using telephone if someone doesn't have access to the video virtual media and that platform. We are continuing to see some people, if need be, in person, and we're always taking care to do it in the safest possible fashion. Our concerns are not only that people who have been in treatment or need treatment might be staying away, but that in these times with so much stress, anxiety, concerns about health and our loved ones' health, and concerns about finances and how we're going to manage, and the changes in people's schedules and the way that people normally take care of their mental health, that we're going to be seeing an increase in people who are suffering from anxiety and depression. And what we've seen is an increase in sales of alcohol, and those are the kinds of things, alcohol, vaping, cigarettes, and other drugs are the kinds of things that can negatively impact your immunity. And during a time when we're all trying to stay healthy, those are very dangerous paths to take. We have a phone number, which is a warm line anyone can call, and it will be answered by a recovery support specialist who can talk to you about how you're doing and can help to direct you if you need more services than they can provide on the phone. I had mentioned that we're able to do telehealth for substance use problems and mental health problems in the Behavioral Health Network, and we have been able to start people on medications and continue their medications through this platform. The phone number for the warm line is 888-984-2408. I think that we're open for questions if you'd like to ask.
This is Claire at the Chronicle newspaper in Willimantic.
Hello, Claire.
Question regarding the admissions process, specifically for someone in the Windham area. How would they seek help at Windham Hospital, and would they be transferred out to Hartford Hospital?
Great. Do I try to manage social distancing on that? So if I understand your question correctly, a patient who maybe may have suspicion of COVID-19 or positive shows up in Windham Hospital, what would happen? Is that the question?
Yes, that's correct.
Yeah, so all of our Hartford Healthcare acute facility has the capability of managing COVID-19 patients. As you know, our system is built in such a way that we're going back into our vision and how the Hartford Healthcare was created as a geared model. That means every single entity in every single region performs to the best level possible. Windham Hospital has a lot of capabilities, and we can manage patients with COVID-19 patients, including the ICU. Now, there are some specialized therapies, where it's ECMO and things like that. We transfer patients to the Hartford Hospital, but generally we like to manage our patients in the local community where they're best served close to their relatives and family members.
Thank you. This is Emily Brindley from The Current. I wanted to ask about the comparison of the Hartford area's increase in hospitalizations versus down in Fairfield County. You said that overall the system is increasing by about 4 to 5% per day. What's the percent in the Hartford area?
I do not know all the numbers of St. Francis in detail. I believe they saw a little bit of decline last 24 hours or so, but I'm not 100% sure on that. But we are seeing the Hartford County is actually rising at this time, a little very slowly, modestly, but it's rising at the moment. And as we had talked about before, the Fairfield County had the initial surge. We saw the New Haven County kind of flattening out at the moment, and the Hartford County in somewhat of a very modest increase at this time. I hope you answers your question, but at least in the Hartford Hospital, we've seen most increase we had was in the Hartford Hospital in the last 24 hours at this time. And I would imagine the same thing is probably true for St. Francis as well, but I can't comment for sure on that.
Okay. And then in general, as the hospitals get to the other side of the peak, can you talk a little bit about what it will look like the first week or two after the peak? I think there's a misconception that once we hit the peak, things are just over, and that doesn't seem accurate.
Unfortunately not. This is a long process. What's going to happen is that when the peak is achieved or is reached, we're going to see a plateauing of activity over the time. It's not going to be a sudden drop. It's going to be a plateauing, and it all depends a lot on how we follow the social distancing measures, how we actually have antibody and PCR testing available, how we isolate, how we quarantine at the time. This fight is far from over. We are going to see the COVID-19 living with us for some time, for a long time, unfortunately, unless we have the vaccines available, as we've talked before. So we're going to see a plateauing and maybe a very small decline in number of admissions are happening across the state, but there's possibly a resurgence as people congregate and we lose our social distancing etiquettes to a certain extent. There is a risk of it coming back. That's why I think we've consistently talked about the best option we have is a vaccine and the therapies which are still in development.
Thank you.
Dr. Kumar, it's Bridget at the Republican American.
Hi, Bridget.
Could you give us an update on the plasma recipients, and also how is the donation program going for that?
You know, we're very encouraged by the donation program. We've got tremendous amount of interest from community members and Hartford Healthcare colleagues actually who are showing up, who are ready for donation at the moment. We had about 16 individuals registered for donation yesterday. I don't know the number this morning. We've had about 11 patients who have received the donation so far. I spoke to our critical care physicians early this morning, and they felt that they were seeing some hopeful signs. However, I do want to make sure that everybody understands they're still part of the research study, and we're still looking into the long-term or at least the benefit. Short-term, few days of information doesn't really help us. All patients are, you know, some of the patients actually have recovered, extubated, or the ventilation, they're off the ventilation, but they are stable at this time, so that's a good news.
So I understand that all 11 patients are off ventilation?
No, I'm sorry. There are a few patients, 2 or 3 patients are off the ventilation, not all.
Okay. Thank you. And a question for Dr. Allen. Compared to maybe January or December, what is the percentage increase in the number of people who are reaching out for help on that, the warm line, or for other kinds of substance abuse assistance?
Yeah, the percentage has actually gone down. So that it makes me very uncomfortable. I don't think that people have that people who have substance use disorders are cured. I think it's possible that some people have really they're really focused on their family and trying to beat this virus. But substance use disorder, it causes changes in the brain. It has components of a chronic disease, and that means that it didn't go away. So I think it's still out there, and you know, I'm concerned that people are not reaching out to us because they think that we're closed or they're afraid of the virus, or you know that they're hidden behind the anxiety and the fear. And you know, maybe they're just not surfacing right now because there's so much focus and resources going towards COVID.
Thank you.
Dr. Kumar, this is Aisha from Fox 61. Just wanted to talk quickly about the announcement that Hartford Healthcare made yesterday about you all's capability now to do 2,500 tests per day. Just talk to me about the impact something like that has in the overall fight with this virus and being able to get back to normalcy, to be able to increase the testing.
Thank you. You know, I think it's a tremendous news, Hartford Healthcare's partnership with Quest to really serve our community and patients in the state of Connecticut. This is actually a big deal to a certain extent. To be able to do 2,500 tests every single day, it's a great momentum for our state, and I recognize the leadership of our CEO Jeffrey Flax and partnership of Quest leadership to be able to pull this off. What it means is that we will be able to offer 2,500 tests every day for the communities which may or may not be able to have an access. We're looking in the shelter areas. We're looking into the folks in the underserved community to be able to make sure that they actually get the testing done. We're expanding our testing capability through creating more sites or access points for the testing to be done. So we're going to see over the next several days significant amount of changes and access to the lab test, which is going to allow us to understand the real prevalence in the community of where we are. Now, mind you, for the state of Connecticut with 3.5 million population, you know, we need a lot more testing. This is it's a great improvement from where we are right now. We are looking into other methodology and possibilities over the next several weeks to expand our testing capability even further. So this is a step which is in the right direction. Hopefully it's going to help us manage our prevalence rate. How it relates to reopening economy and reopening our business, this remains to be seen. As I said, the testing is one part of the puzzle. Social distancing is the second one. As we learn about the antibody testing, the more science comes forward about the utility of that test would help us to a certain extent. And obviously, all those things we do, it has to be phased approach. It has to be methodical. It has to be coupled with the contact tracing. So in Hartford Healthcare, we're looking into how do we actually augment our contact tracing within the healthcare system? How do we actually make sure that the tests are utilized in the most appropriate fashion to serve the right type of people? And we want to make sure that our antibody testing gets off the research platform so we can utilize it further.
Thank you.
Hi, this is Nicole from Connecticut Public Radio. Dr. Kumar, I wanted to ask, as we do see the daily admission rates increase in some areas, especially in Hartford County, what do you think in terms of, do the hospitals have, in your opinion, sufficient staffing and also the physical space to put patients as the hospitals do admit more patients in the next couple of days or even the week?
Yeah, you were breaking off in between. If I understand your question correctly, I think you're asking, do the hospitals have adequate capacity and PPE and manpower to sustain the surge and as we go forward? Hartford Healthcare does. Actually, we've been preparing for a long time, and we have adequate capacity. We have PPE supply as well, and we have a wonderful colleagues across the Hartford Healthcare who are committed and ready to take care of what needs to come. We feel we're going to be fine at this time, and given as we've been managing, we've been very disciplined about approach, especially about the PPE, about redeployment of individuals across the system. So we've done a lot of wonderful things to be able to prepare ourselves. I do want to highlight one other thing. Hartford Healthcare is probably one of the only organizations, at least I know, who have taken the step to create a colleague support center. We also have a wonderful 24-hour phone line available for all our colleagues across the Hartford Healthcare who are going through emotional challenges, having a difficulty coping at this time, or maybe having a challenge with childcare, or place to stay overnight after a long shift, or redeployed in some part of the organization where they may not be able to go home at some point in the hours. We're making sure that hotels are provided to the individuals. We have done a lot of other work to providing the break room access and things like that, providing the food and support. So Hartford Healthcare has done a variety of different things to make sure that colleagues are supported, and the resiliency of the team is going to matter the most as we go in the long fight with the COVID-19. So we feel we're prepared not just from the capacity, but variety of other fronts as well.
Just a quick question on that. Field hospitals that up, especially in the southern states, beds hadn't been used yet. We are seeing a plateau, or some of the counties reporting hopefully a decline in their peaks. Is there such thing as, in your opinion, as being prepared in a pandemic, or everyone preparing as much, especially in aspect of the state?
You broke up several times. I'm trying to piece your question as best I can. I think you're asking, are we over-prepared, or did we over-prepare? Is that the correct question?
Yes, that is. Can you hear me?
Yeah, I can hear you a little bit better right now. I don't think we were over-prepared, or I don't think we were under-prepared as well. We responded in a most appropriate way, the way we understood the science and the evolution of the disease. We've never faced a pandemic for several in decades in the United States, so we really did not know what to expect. Novel coronavirus is unlike anything else we've had before. Right now, we don't really have a test. We don't really have a cure. We don't have a vaccine. All we have is a lot of common sense and social distancing. So as the hospital systems and the healthcare organization, as our state has prepared and responded to the best of the knowledge we had. Think about a scenario like what has happened in Italy, what is happening in some part of the country as well, with a large number of lives being lost. And that is something we want to avoid, we want to prevent. Our job as a healthcare professionals in the community to really think about the worst possible scenario and respond as appropriately as we can. And there have been times during this fight, and the times will continue, we're going to have some trepidations about the supply chain and many other things as well. But I think I cannot understand the fact that we have actually done what we think is the most appropriate thing to do. I don't think there is anything like over-prepared for pandemic. I think we can always prepare better and more. And still, when we think about where we are, we could have done something different. We could still do something different by increasing testing capability. That's why Hartford Healthcare is really working so hard to make sure the access to the testing is available. Research in medications and vaccines, they are very important things to be doing in accelerated phase. And if you support our communities, a lot of things which are happening in supporting our businesses and in our people within the community, I don't think we are over-prepared at all. I think we have responded as appropriately as we can.
Thank you.
This is Aisha from Fox 61 again. I just had a side question. Not sure if you have that number readily available. I can try to get it later. On the number of your healthcare workers that have been COVID positive so far?
Yeah, I don't have the exact number right now, so we can circle back with you later on. Hartford Healthcare had been, we started several different processes, such as a visitor restriction, travel bans, and a few other things. So we were able to really protect our employees quite a bit. What's unknown here, because the way the disease has spread in the community and the widespread community spread has happened, is how many of the infections occur in the community versus in the healthcare setting. How many of the infections could possibly occur from colleague to colleague when we're working in the same area who are asymptomatic carrier. So there has been some challenges actually for most of the institution, but I will get the numbers for you at some point later.
Thank you.
I'm going to have Dr. Allen to say last few words, and then after that, hopefully we'll adjourn the meeting. Thank you.
I wanted to address a specific substance use disorder. People who have opioid use disorders. That's a substance use disorder that has 3 FDA-approved medications that effectively treat it. And people who are taking those medications decrease their risk of overdose death by well over 50%. It is essential that people are able to access those medications. I'm talking about methadone, buprenorphine-based medications like Suboxone, and then the antagonist medication naltrexone and naltrexone extended release. Another name for that is Vivitrol. There have been a number of changes to the regulations around dispensing of methadone from methadone dispensaries and the prescribing practices for Suboxone and buprenorphine. We want people out there to know that there are ways to access that medication. If people aren't able to get their medication, they're at incredibly high risk of relapsing. And although there has been a shutdown of many different businesses out in the community, one of the businesses that hasn't been shut down is the illegal business of providing these illicit substances, which can lead to overdose death. And before the pandemic that we're currently experiencing, there was an opioid overdose crisis. And I don't think that that's gone away. The risks are still very high, so I wanted to get that message out there. Thank you.
Any further questions? Do you have anything on the Facebook?
Nothing.
All good. Well, thank you very much. I hope everybody stays safe and more to come over the next several days. Thank you.